This episode of CLP TV is brought to you by Leica Microsystems. Leica Microsystems brings histopathology laboratories and researchers the highest quality, most complete product range.
Hello and welcome to this episode of CLP TV. I'm John Doherty. First up today, Amsterdam Molecular Therapeutics is working with several other research institutes to help children with a rare and deadly genetic disease. The consortium of researchers is led by Institut Pasteur. The group has developed a novel gene therapy it hopes can treat Sanfilippo B. Sanfilippo B affects newborn children, leading to progressive neuronal degeneration and death. Researchers hope their gene therapy will replace an enzyme that is missing in brain cells of Sanfilippo B patients. AMT will manufacture and supply the adeno-associated viral 5 gene therapy product to the consortium. Currently, there is no approved therapy on the market. Leica Microsystems introduced its online shop for consumables in North America at the beginning of 2011. The online shop is an easy way to shop for histology consumables and general laboratory supplies. It brings tremendous advantages for customers: 24-hour access, order tracking, recent order history, personalized account terms, and payment through a number of convenient options are some of the features the shop offers. We are excited to offer our industry partners another avenue to search for and purchase our wide range of histology consumable solutions at a time convenient to them. Tailored account information for registered customers allows Leica Microsystems to ensure that users get the right product information quickly, says Tim Lyons, Global Marketing Communications Director at Leica Microsystems. And in other research news, BioHeart announces a breakthrough in critical limb ischemia therapy using stem cells obtained from fat tissue. The study focused on end-stage patients with severe wounds. Endpoints include elimination of major amputation risk, ankle brachial index, toe pressure, transcutaneous oxygen pressure, and quality of life. Among the other findings were 75% of patients presented with healing and pain reduction, while only 25% of the patients required major limb amputation due to disease progression. There were no reported deaths or adverse effects, demonstrating the safety of the products. Now let's take a look at business news. The Tekken Group has signed a license agreement with Enigma Diagnostics Limited. The collaboration allows Tekken Group access to Enigma's intellectual property used in its Enigma ML system to develop a next-generation molecular diagnostics platform. In a related story, Discovery Labs has updated its marketing authorization program regarding its effort to gain FDA marketing authorization of Surfaxin. Surfaxin is Discovery Labs' synthetic peptides-containing surfactant. It helps prevent respiratory distress syndrome in premature infants. Discovery Labs Chairman and CEO W. Thomas Amick says considerable progress has been made towards the filing, and he believes the company could be in a position to file a Surfaxin complete response by early third quarter in 2011. The Surgipath tissue marking and margin dye kit from Leica provides exceptional dye quality and consistency. Pathologists can rely on the outstanding performance of the Surgipath tissue marking and margin dye kit when isolating specific areas of tissue and identifying surgical margins. The special formulation improves diagnostics with a viscosity carefully selected to avoid running and oversaturation. The tiered acrylic base conveniently holds a complete set of dyes, giving you more space in the grossing area. With a regular tip for high volume and a tapered tip for precise application, the dual-end applicator brings a convenient innovation to the market. Surgipath tissue marking dyes are another example of how Leica helps you enhance workflows to deliver better patient care. For more information, visit www.leica-microsystems.com. And in other news, Thermo Fisher Scientific has announced the introduction of its new Herathern microbiological incubators. The benchtop incubators come in 3 different models: General Protocol, Advanced Protocol, and Advanced Protocol Security. Each unit is available in 60, 100, and 180-liter sizes that feature inner glass doors to maintain temperature uniformity. In addition, a compact 18-liter model incorporates Peltier technology to provide temperature conditions around or below ambient for space-restricted labs. Access Closure Inc. has announced the launch of its next generation vascular closure device, which offers a marked advancement in closure procedures. The Minx Cadence features 3 changes that makes it easier to use. First, it has a definitive shuttle stop. This reduces the possibility of over-shuttling when deploying the sealant. Next, a single marker on the advancer tube removes any guesswork around sealant compression. And finally, a new sealant sleeve protects the sealant during deployment and shortens the procedure time by eliminating the need to pre-soak during device preparation. These changes result in a more consistent sealant delivery. This episode of CLP TV is brought to you by Leica Microsystems. And that concludes this episode of CLP TV. We'll see you next time.